Welcome, friends, to this very special episode of Gender Equality Talks. We have a very special guest amongst us, a leader in obstetrics and gynecology, not only in Thailand, but also has influenced the discourse globally. Professor Unnop Jaisamrarn, I hope, sir, I pronounce your name correctly, the Secretary General of Royal Thai College of Obstetricians and Gynecologists. And now let me share more about him, but I am sure that many of you will already be knowing he's Chief of the Family Planning and Reproductive Health Unit in the Department of Obstetrics and Gynecology, Faculty of Medicine at Chulalongkorn University, which is a very reputed university globally in Thailand. He is Associate Dean for International Affairs of Faculty of Medicine, Vice President of Thai Menopause Society, President of Thai Osteoporosis Foundation, Secretary of Forum for World Health Organization, WHO, Multicenter Research in Reproductive Health, and Secretary General of WHO Collaborating Center for Research in Human Reproduction. Professor Unnop, welcome. We are so proud to have you amongst us.
สวัสดีครับ
Swadikap.
Hi everybody.
And such a lucky day or time zone with Loy Krathong and Thai festivities going on, with the blessings of Lord Buddha. So, Professor Unnop, let us dive straight into the subject, because we know that you are so busy with the upcoming International Conference on Family Planning, and Royal Thai College of Obstetricians and Gynecologists is also one of the co-hosts, along with Ministry of Public Health of Government of Thailand in Pattaya. So can you please share a brief overview of the family planning in Thailand? Thailand has been a leader on several public health spheres, and family planning and reproductive health is certainly one of them. And over to you, Professor Unnop. Thank you.
Yeah, exactly. I mean, your understanding is correct. For like public health and particularly for family planning, Thailand has a very successful family planning program. You might be aware that like 50 years ago, at that time in 1960, Thailand is like just a rural society, and we have so many kids per family. At that time, it's like more than 6 children per family, and we were lucky that the government, together with other partners in our societies, realized the problem of the increasing number of the population. So we have the what we call the National Population Policy and Family Planning Program in late 1960s to 1970s, and the cooperation among partners in our society have led to a very, successful family planning in our country. The number of the children per family, technically we call the total fertility rate. At that time, like 50 years ago, it was very high. It's like more than 6. At the moment, where we are now, we have only 1.2 kids per family. That is two success in family planning. So we now have the below replacement fertility at the moment. And the uptake of the family planning method or contraceptive prevalence rate in Thailand is very high. It's like more than 70%. It means like the married couples, more than 70% use the modern type of contraceptive method.
Yeah, thank you so much, Professor Unnop, for this overview. And it is really an important feat, and I hope that other countries also, pace up, because we have sustainable development goals, and the promise of gender equality is enshrined in one of them. And so what more can be done, Professor Unnop? A lot of progress has happened in Thailand, which is so inspiring, and a lot of lessons have been learned also and are being adopted in other countries. I'm seeing in other spheres also, like for instance, HIV, STIs, including family planning and maternal health and childcare. However, there's, like for instance, instance, unintended pregnancy is still some challenge. So can you please shed some light and insights on how can we do more on them, tackling these challenges? Thanks.
Yes. So for in Thailand, although we have a successful family planning program, I mean overall or in general population, but we still have a group of would say population that underserved, that is adolescent. We still have a problem of the unintended pregnancy, particularly in the adolescent people. We are now, I mean, trying to bring down the birth rate of the adolescent. We need to work together between the government. We need to have a strong leadership from the government, from the Ministry of Public Health. We need to have the cooperation among, I mean, all partners like academic institutions where I'm here in the universities. We also need help from other partners like the NGOs and some other organization in the country. Not just only the government organization can help. I mean to address this problem. And the most important thing, in my opinion, is the education, the awareness of the unwanted pregnancy in our society, and the trying to provide the easy access to reproductive health and also the family planning and contraceptive services, I mean, throughout the country is very important. And we also need to have a very good referral system for the clients who need, I mean, more service or further service. This is very important, in my opinion.
Yeah.
And the most important thing for the success in our country, in Thailand, is to integrate the reproductive health and family planning services into the country healthcare system. We used to have, we call primary healthcare system, I mean, long time ago. And now in Thailand, we have the universal health coverage, or UHC, and we integrate family planning, including maternal health care and reproductive health services into the system. So it means that all Thai citizens, all people living in this country can have access to that service. This is very important. And I think to integrate family planning and reproductive health into the national healthcare system or universal health coverage, universal healthcare access is the theme for ICFP 2022, the upcoming, I mean, conference in Thailand, in Pattaya.
Right, absolutely. Let's hope that your words become a reality globally, that people have universal access to all the services they need. So, Professor Unnop, you have already led us to what I'm going to ask you is about your message to the upcoming International Conference on Family Planning. Thanks a lot for your support and leadership, and also to Royal Thai College of Obstetricians and Gynecologists and Ministry of Public Health of Thailand and all the co-hosts of the ICFP 2022. This is the first time, if I'm not wrong, ICFP has come to Thailand. So
Exactly.
we really look forward to you. So I will, please, your message, sir. Over to you.
So come and join us in Pattaya City in ICFP 2022. I would say this will be the biggest, not just only the conference, but the biggest platform for everybody who work in the field of reproductive health and family planning to come together and interact to each other for, like would say, better family planning to achieve the goal.
Yes. Totally echo your words. Let's hope that we all come together in Pattaya, and those who can't, please join us virtually. ICFP is a great opportunity to re-energize and revitalize efforts for family planning and universal health coverage. So all the best, Professor Unnop, all power for ICFP 2022. We will be there. We look forward to ICFP 2022 next week. So thank you so much again, and for your time and sharing your insights with us.
Yeah.
All the best, sir. Thanks a lot.